Hello, I'm Ross McDonald, a librarian at the Distributed E-Library at World Canal Medicine, Qatar, and I'm here today with Dr. Alwaleed Alkhaja, who'll be delivering the keynote presentation at the library's Evolving Health Information Landscape Symposium on the 2nd of December 2021. Dr. Alkhaja is the Senior Intellectual Property Librarian at Qatar National Library, where he manages QNL's Open Access Fund. This fund has so far supported the efforts of over 570 authors from 24 institutions in Qatar to publish in open access journals. Dr. Alkhaja is also QNL's representative on the board of the Global Sustainability Coalition for Open Science Services. Dr. Alkhaja, thanks for coming along.
Thank you for having me. It's a pleasure to be part of this conference symposium coming up.
Yeah, and you'll be talking there about open science infrastructure. Can you just tell us what that actually refers to?
So I think to describe this term, open science, when we need to talk about open science, we need to talk about open and what is infrastructure. And I think the first part for all this, any conversation is to define what we mean by open. And of course, we all know what science is, but what open science is basically science that, or the scientific kind of products, services, output that is free to use, that can be modified, and that can be shared with anybody for any purpose. And when we talk about open science, it's really an umbrella term that defines or covers various movements and practices, such as open access publishing, which I'll be discussing at my presentation, but also open data, open reproducible research, open science evaluation policies, but also infrastructure. So to answer your question, what is open science infrastructure? It's infrastructure is basically services and tools or products that allow us to practice open science. And they can come in different shapes and forms, from publishing platforms to tools for open citations to any tool or service that we need to basically practice open science.
So, if you're practicing open science, how does that impact access to health information, for example?
Well, we need to start with the problem that, or at least define that there's a problem with access to information in general. Not everything that's published or not everything that is produced by scientists is openly available. And again, I need to emphasize the word open. It's not simply to make it free. Free information, or there's nothing really free, but free information or that you don't actually have to pay to read isn't enough. So when we look at health information, or health sciences, or the medical field, there's a plethora of information that is not accessible, that we don't get access to. One of the movements of open science is making sure that that the output of let's say the research in the health field is made openly available, that people can read it for free, can reuse it in certain cases, but also the data behind it is also available. And one example that I'll be talking about in my presentation is, of course, the pandemic. That pandemic, we can see it, of course, I mean, it changed our lives, but it also was an opportunity to see how open science can influence how we do research. So there was a call that all output or research that's related to COVID-19 would be made available. And I think publishers, responded and made articles freely available, but again, they're not open, or not all of it is open access. And again, there's a lot of information out there. I think there's an opportunity for making things open in the sense that, we look at open publications, open data, open peer review, and that would give us more trust in what information is. So I think the health, like let's say the health information or the health field or health professionals would definitely benefit from having more open information out there.
Now I mentioned you were QNL's representative on the board of the Global Sustainability Coalition for Open Science Services. Clearly this is related to what you've been talking about. Can you tell us more about that organization, its aims and activities?
Yeah, so it's an organization composed of different representatives from various institutions around the globe, and the goal of SCOS is to connect those who need funding So the open infrastructures that need funding with those who have funding to provide. And usually these are libraries, but they could also be government research institutions or funding agencies. And the goal is to provide, let's say, a selected list of vital infrastructure and to communicate this to the community and saying, we need to support them and we need to support them now. The issue that SCOS is trying to address is that many of these infrastructure service providers need money to be sustainable on the long term. And SCOS's goal is to connect again introduce, well, not necessarily introduce, because we all use these tools, but to communicate the need for funding and facilitates basically the process of let's say, like these institutions getting money from different funding providers. And I mentioned that we all know these tools, so we use them as like researchers, as librarians, as anybody in even the health profession. So, for example, one of those tools that was successfully, well, service providers was successfully funded was the Directory of Open Access Journals. Another was Sherpa Romeo. Others, like, were selected, are used by libraries and researchers on a regular basis. And yeah, since it was set up in 2017, SCOS was managed to gather, the amount is like about 3.4 million euro that is distributed to all different infrastructure.
QNL itself also provides considerable support to researchers of open access publishing. I mentioned the QNL fund. How else does the Qatar National Library work to promote open access? I mean, there's you, apparently, are one of its resources for this. Does it do anything else?
Open access is one of the as Qatar National Library, one of our values. So we believe that open access to information is critical to achieve our mission. Now, of course, we do the fund, and the fund, as you mentioned, the service that we provide on a national level, and it allows the library to cover the fees for researchers in Qatar who can't or don't have available funds for the APCs or the article processing charges for open access. Other means of us like supporting open science is through the Open Scholarship or Open Initiative Award, which we have is now we've given the award twice. First time last year, and this year was the second edition, in which we try to and reward initiatives in Qatar that support open science or open scholarship. In other ways, the Qatar Digital Library is a platform of historical content, and the items there are either freely available as public domain or licensed under Creative Commons licenses. So that's also open access. And yeah, so these, I would say, are the three main ways that we support open access. And of course, I think it's very important to mention what we're doing as the library through the Qatar National Library Consortium. So this is a consortium in which there are 10 different institutions in Qatar that are part of it. And we work together on agreeing and negotiating agreements with major publishers to ensure that any subscription agreement that we sign on a national level also has a publishing component. And this is what we refer to as, let's say, read and publish agreements. And the idea here is that we want to pay the same cost for subscription, but also get more, in the sense that we can get articles. The agreements would allow that articles from Qatar-based researchers are covered and made open access.
Open access crops up a lot. What do you think are the other major challenges for Qatar and the MENA region regarding health information that now and in the future?
You mean like in open access or in general?
In general, yeah.
There's a lot of work that is done. I think we need to give credit here that there's a lot of research taking place. A lot of work has been done by different institutions in the region. The problem, however, is that on the long term, how do we access this information? And what's the visibility of this? I do have to come back to open access because I think that's the solution here. It's a solution, but it also has some challenges. So the solution is that, yes, all this research needs to be visible, and open access will make it visible worldwide. The problem, however, is funding this. Now, I think there is no doubt that health, like articles that are published by in the health field, once they're made open access, they have a higher chance of being read, being visible, and have high impact. The problem, however, that we have in the region is how do we fund the publications? Now, the problem, one of the issues with open access is that not every journal is free to publish. So you have to pay a certain fee. And the issue or the struggle I see in the region, locally and in the region, is how do we pool our efforts and money together to make this possible? Of course, we have some success with the consortium, but I think we need further collaboration between different stakeholders. The other thing is we need policies and mandates locally and in the region to say, yes, anything published from public resources, from public money, should be made available openly. Now, in general, when it comes to health information, I think the same issues that other regions have are applicable here. And it's that we need more transparency, more accountability of the content or the research that is being done. And I believe that open science practices are a solution. We just have to bring key stakeholders together and work on a long-term plan.
Okay. Dr. Alwaleed Alkhaja, thank you very much.
Thank you so much, and looking forward to presenting at the symposium on the 2nd of December.
Yes, and thank you for listening. I've been talking to Dr. Alwaleed Alkhaja, and you can hear more from him, as he mentioned, about open science and health information at the Evolving Health Information Landscape Symposium on the 2nd of December 2021.